The role of the pharmacist in bone marrow transplantation is to provide pharmaceutical care to achieve the maximum clinical benefit for the patient and providing improving healthcare outcomes in an efficient way.
The role of the clinical oncology pharmacist is not only validate or verify the chemotherapy and how we prepare the chemotherapy. We also explains treatments to the patient. We do educational to patients. We verify interactions with other drugs. We follow adverse events, and we do therapeutic drug monitoring.
We work every day in avoiding drug-drug interactions, drug-food interaction, drugs, alternative therapies. We also work in drug therapeutic monitoring and reconciliation charts, so we have many work.
This year will be the first Pharmacist Day because, first of all, because Pharmacist has asked to the EBMT to employ this new Pharmacist Day, and as a recognition of our, we are more involved in the stem cell team. So it's like we are part of this team, so we have to be here.
EBMT and oncohematology pharmacists, we both think that we have to work here to share knowledge here as we do in our hospitals. Because it was the first Pharmacist Day here, we think it was important to think what we are doing in the clinical team and where we're going to go.
Will we talk about very different pharmaceutical topics, such as what's the role of a pharmaceutical in the stem cell transplant team, about busulfan or immunosuppressives monitoring, adverse events, new drugs such as idelalisib, very different topics.
One of our main difficulties is the complexity of the drug regimen that could go to a high-risk drug-related problem. So we have to work very hard in it.
We usually give a lot of orders to the patients, but we should give more advice to our patients. And it must be something that they have to trust in our team. You know, we want to have the best results for our patients.
We are bringing together two societies, the European bone marrow transplant and the hospital pharmacists. We are beginning a network, and that's good for us because to share information and to share the same problems, it's good for the patients. The patient will win with it.
The most important thing is that the patient that goes to do the transplant is winning, because both physicians, nurses, pharmacists, we are looking for the best treatment with the less adverse events.
We think this will be the first of many Pharmacist Days coming in the next years. We hope that.